everyone, once again welcome to my Oet channel. Today we will see another one role play. This is the role play card on July 9, 2022, and it's related to type 1 insulin dependent diabetes and insulin therapy. So in this case note, actually you are talking with a 28 years old accountant, and she is recently diagnosed with the type 1 insulin dependent diabetes, and doctor prescribed him insulin on daily basis. So this is a self injection, but she is very afraid to take injections by herself. So she is asking some questions regarding the condition and the insulin, the method, everything, and you are there in the medical clinic to explain everything to her. So we will start. First, I will read the settings for you. Actually, the setting is medical clinic, and the scenario is you see a 28-year-old accountant recently diagnosed with type 1 insulin dependent diabetes. She is very anxious about having to inject herself on a daily basis. The patient is attending the clinic today to find out more about the insulin injections. So this is the scenario. So you have to just imagine that you are sitting in a medical clinic and one patient comes to you. Comes to you, and the patient's details are with you. So you are getting confirmation from the patient that she came for this and this. Then you are starting the conversation. Okay, so how we can start the conversation? You can see the first task is confirm reason for patient's visit, insulin injection information, and find out how patient is feeling about the diabetes diagnosis. So here, actually, this medical clinic means here there is a doctor. Actually, this patient got information from the doctor in this medical clinic only. That means the doctor is in the other side and you are in another one side. So through the system, you will get information from this doctor, because that doctor is the one sent the patient to you to get further more information. So as I told you before, if you see the video of confirm, means it will be easy for you to start the conversation. If you didn't see the video, I will just explain you how to start a conversation with the confirm. So if you see the term confirm, means we have to tell them back regarding the reason for the visit. So what we can do: good morning. Then we are greeting. Good morning. My name is Rashmi Rajan, one of the registered nurses working in this medical clinic. For further conversation, may I know your complete name, please? Then patient is telling that my name is Maria Josephine or something. Then we can tell that, well, Maria, from my system, I can confirm that you came here to get some more information regarding your insulin injection and about your disease condition, isn't it? So like that, we can ask back. Or else we can ask that, if I am not wrong, you are here to get some information regarding insulin injection and regarding your diagnosis diabetes. Am I correct? So like that, we can ask back. Then the answer will be, yes sister, I came here for that reason. Then we can tell that, before proceeding further, may I know what you know about the diagnosis diabetes? Then the patient is telling that, actually, sister, I am very much shocked when I got the diagnosis, because I am only 20 years old, and I'm thinking that how I got, because I'm not eating too much sugar and any fatty foods and all. And I don't know, because I know that diabetic means it is related to sugar, and it will affect the people, those who will eat more carbohydrate and sugars. And other than that, I don't know anything regarding diabetic. Then, as an answer, we are giving information that the next task is we are giving information about type 1 diabetes. Then we can tell that, well, Miss Maria, no need to worry. I am here to help you. I will explain you regarding your diagnosis, that is type 1 diabetes. And I want to tell you that it is not related to sugar problem. It is the medical condition in which your body will fail to produce insulin, that is the hormone which needed to convert the excess sugar in the blood. And in your case, the insulin is very decreased in manner, so we need to inject insulin injection. We need to inject insulin medication to manage your condition. So that's why your doctor has prescribed you with auto injection of this insulin. So are you getting my point? Like that we can tell. Then the next task is reassure patient about injections. And before, I want to tell you that no need to give extra or more informations, because you can see that we have only 6 tasks, but inside you have more subtasks. So if you want to give more explanations, you will lose the time. So no need to give any additional information. Just in a simple manner, you can just explain every task. Then we will move to the other one task, reassure patient about injections. Like insulin pens, usually painless, needles small or thin and become routine, etc. So we can just start like this. Miss Mary, do you have any concern regarding your insulin injection? Then the patient's answer is, sister, to be frank, whenever I will see the injection, surely I will have faint, and really I will have giddiness. If I see someone is someone is injecting medication to someone, then how I will take myself? Really, I could not understand how I will take, and I don't know from where I will get the help. Then we can tell that, Miss Mary, I can truly understand your concern, but no need to worry. These insulin injections are not same like other injections. You don't have any long needles to inject the medication, and your medication can be injected through the insulin pen, and it is usually painless, and needles are very thin and very small. And once if you start to take the injections, it become a routine. So no need to worry about your injections. How does that sound? You can ask, how does that sound? Then the patient is telling that, okay, sister, anyway, I will just manage with my self injections, and if I have any problem, of course, I will get the medical advisors. Then we are asking that, well, Miss Maria, do you have any other concern regarding your diabetic or insulin therapy? Then she's telling that, yes, actually, I am worried about the side effects of the insulin therapy. And we can tell that your questions are reasonable, and I can explain you regarding the possible side effects of insulin therapy. So initially there will be weight gain, can be expected, and once if you inject in your arms and legs, there will be swelling also, can be there, swelling of arms and legs also. But no need to worry, these are all mild side effects that can be manageable also. But please think about the benefits of your insulin therapy, because when you will take the insulin, your energy level become increased, and your lifestyle will become flexible, and you will have the better life, better lifespan, and moreover you can improve your well-being also. But if you skip your insulin on time, if you are not taking insulin on time, your energy level will become low, and the life expectancy, it will not be as what you desire. So I'm strongly suggesting you to continue with your insulin therapy. Now you got a point, or are you following me, or is it clear for you? Like that we can ask. Then the next task is emphasize that insulin injections won't cure diabetes. So because the patient have some more concern, so I can ask that, Maria, you still look anxious. Is there anything to be clarified? You can just ask me frankly. Then you can tell. Then the patient may tell you, sister, it is good to have more information. So you have really like to be shown how to do the injections. And and I have another one more queries. These insulin injections, whether it will cure diabetes completely. So patient have 2 questions. So we have to just inform that, Maria, I can understand your concern. Being a patient, you are overwhelmed about the condition. But I'm really sorry to tell you that insulin injections won't cure diabetes, but it can only delay or prevent complications of diabetes, because there are more complications related to diabetic if it's not controlled. There will be vision impairment, poor peripheral circulation, so it can lead to many complications. So please try to understand the benefits of your insulin therapy, and I'm reassuring you that if you follow continuously, if you follow your insulin injection, of course you will not get your any complications from diabetes. Then And I hope it's clear for you. And I want to answer for your second question related to the insulin injection, the demonstration. So no need to worry, I can demonstrate to you the next dose, when the next dose sorry, it is not a next dose. I can show you the demonstration how to self inject your medication, so that you can do it at the home in the same manner. And moreover, I would like to give you some pamphlets or leaflets in which you can see step by step instructions of insulin injection. Is it okay for you? Like that we can ask. The patient is telling that it's okay, fine sister, thank you so much. Then the next step is you are going to demonstrate the procedure. So how we can conclude? And next, before going conclusion, you have to ask, do you still have any concern, any more concern? Then patient is telling that no, I don't have any other concern, just I want a demonstration of insulin injection administration, self-administration. Okay, fine, my dear, I hope I have clarified all your doubts. If you don't have any other clarifications, may I proceed with the demonstration of self-injection of insulin. So that's the conclusion. So in this way we can conclude the conversation. So here there are two things. That means the diagnosis we have to explain, and we have to give the benefits, and we have to explain about the benefits of insulin therapy, insulin injections. So these two things, it will go in same way. And whenever you are present, don't forget to put the tick mark over the subtask, because in this case scenario, like at a practical way, patient can ask the question from anywhere. So you could not expect that your interlocutor will ask you in an order. Most probably they will ask in an order, but rarely some interlocutors can ask you without order. So don't get confused. So for preventing that confusion, to avoid that confusion, you can just put tick mark in the side, in the subtask itself, not even the task, in the subtask itself. So whenever they will ask you question from down to up or in between, you can answer for that. Just put the tick mark there, then you can go back to the previous tick mark, so that you will have the continuity of conversation. So I hope it's clear for you. And in this role play card, there will be more advices. Advices means, of course, you should not tell, you have to, you need to, you should, these things and all you have to avoid. In this area, you can just tell you can just present in the way that it is essential for you to, it is beneficial for you to, it is important for you to, please try to do, please try to avoid. Don't use like don't, that term please avoid from our role play, avoid in our role play. Instead you can use please try to avoid. Okay, so in that way you can present this role play. I hope it is clear for you. Just try to do it with your friends. So I hope it will be beneficial for you. Thanks for watching, and we will see you with another one informative video. Until then, bye, take care.